In this video, we are treating a patient with neurotoxin, but we are starting off by marking her frontalis. So we are marking her lateral borders, and then I am filling in with just some estimated injection points. Just because this is where I'm eyeballing when I'm marking doesn't necessarily mean it's exactly where I'm going to inject, but I like to mark out and just plan so I can better estimate the amount of units I'm going to be using. For example, as you can see on the left side of the screen, I have a lower injection point for that side. She has a little bit of a natural spocked eyebrow. So every single patient's dosing and placement is going to be a little bit different. But now I'm going ahead and starting to inject. For the frontalis, I am always injecting up towards the crown of the head. So just keeping my needle facing upwards. I like to pull the skin taut just so my needle can slide in a little bit easier. If I see vasculature, I do try to avoid it, but unfortunately, if you can't see it, you will get some bleeding. With aesthetic treatment, it should be expected. We are poking a needle into the patient's face, so some bruising is possible, but if I can see a vessel, I do try to avoid it. And this is my extra lower injection on that left side, just because she does have that natural spocked eyebrow. And just finishing off with the rest of my units here. Now going into the glabella. The glabella is composed of the procerus and then the two corrugators. I am injecting my full needle depth and just holding a gentle pinch. Our medial corrugator is a deep muscle on that brow bone, so I am injecting my full needle as well. And just gently holding that pinch. And same thing for this side, I am using that full needle. For the lateral tails of the corrugators, it is a superficial muscle, so I am only using about half, sometimes even a little bit less than that, of my needle. If you're treating too high or treating too deep, it is possible to hit that frontalis and give that patient a brow drop, so just ensure correct placement. Now moving on to our crow's feet, I'm using my left hand to pull and just apply some tension so it's a little bit easier to inject. Again, if I can see vasculature, I do try to avoid it if possible. This is a superficial injection. I'm always facing away from the eye. And when I'm choosing my injection points, I'm palpating that orbital rim, and I always want to make sure I am on the outside. And just having that patient animate as I follow along, almost in a C-like formation. We want to ensure we're not coming too low along that zygoma because you will hit a smile muscle.